Good morning, everyone. So today we're going to be doing getting into some good hip mobility, neck mobility, and then I want to get into some light core work, working on pelvic tilts, lean backs, getting into that lower core, and then some glute activation to finish. So let's go ahead and get started. So let's start on our back, getting into our crocodile breath, making our big C shapes with our hands. Hands going below rib cage, above hip bone, in that nice meaty section of the abdominal wall. Getting that nice bracing of those hands so that we can kind of squeezing in a little bit so that we can create resistance, so that we can feel the inhale phase of that breath. And I want to feel on that inhale, that nice outward expansion, like we're using that abdominal wall, we're inflating it up out like a balloon. I want to feel that inflation press into the thumbs in the low back, into the index fingers at the front, and into the palms through the side. We're going to inhale in through our nose and exhale out through the mouth. We're going to get a good 5 to 10 nice slow breaths. And I want to think of these breaths as we're just slowly working to activate that core with our breath. So start small, small inflation. Each inhale, see if you can get that abdominal wall to expand a little bit bigger. As you inhale, you may notice the shoulders want to tense or roll up a little bit. You may even feel the head want to kind of get involved. On the exhale, try to relax and let the shoulders soften, the head soften, drawing that navel up and in, and then inflating on that next inhale. Again, each breath, trying to get that expansion a little bit bigger. How big can you feel that balloon expand? And start to notice how much symmetry do you have in that expansion? Do you feel an even amount of pressure pushing into the thumbs and out through the sides as you do moving forward into the belly? Do you feel it the same moving to the left side of the body as you do to the right side of the body? Or is one side a little inhibited compared to the opposite side? Once we get 8 to 10 breaths, we're going to very slowly come up to a sit and get into our shin box position. So I'm starting in my left side shin box. Left knee is forward. Left hand is coming just outside that hip. Grounding palm. We're going to spiral that elbow out and away so that we can feel that shoulder blade packing down and back. Nice tall spine. We're going to start with our hip openers. Breathing into that belly as we exhale, drawing the navel up and in. Lifting that knee up slowly towards the ceiling. Inhale as we let it back down. Continuing to inflate that crocodile breath. On the inhale, exhale, feeling that navel draw up and in as we open. Want to make sure we are not opening up or moving that shoulder. I don't want that shoulder to open with the hip. So I want to keep the chest and the sternum square, not moving, only that hip moves. We'll do a good 5 up to 10 slow reps. Notice, where do you feel the tightness and tension in this hip? Do you feel it more in the top front of the hip? Do you feel it more in the adductor? Do you feel it in the more in a pinch in the glute? And once we get 5 to 10 reps, we're going to very slowly transition to the other side. Again, rounded palm, spiraled out elbow, packed shoulder, tall spine. Inhale into that crocodile breath. Exhale as we open up that knee to the ceiling. Slow squeeze. Inhale as we bring it back down. And with each one, we're seeing if we can get a little more lift in that knee, opening up that hip. Starting to feel, where do you feel it on this hip? Is it different? Do you feel it more in the top front, in that adductor space, or do you feel it more in the glute in the rear? Is this hip tighter, or was the other hip tighter? How high is that range of motion as well? Do you get as much lift on this leg as you did on the other leg? Once we get 5 to 10 reps, slow transition back across to the other side. Going to get into that back hip bowl. This is where I want to imagine that breath. It has a weight, like it's filling up a bowling ball. And as it fills it up, it sinks into that back hip, and that back hip starts to reach to the floor. As we exhale, we're letting that hip lift, slide forward, and actively scooping, trying to take our tailbone and reach that tailbone forward so that we feel some stretch through the front of the hip, as in a contraction in the glute. Inhale, let that breath drop into that hip bowl, reaching it down to the floor. Exhale, lifts that hip off the floor, actively scoop. And with each one, we're trying to scoop a little bit more. Try to get a little bit more stretch, load in the front, as well as contraction in the glute. If you're able to feel that contraction in the glute, I want to continue to actively scoop to maximize that contraction. I want to feel that glute start to burn just a little bit from that good scoop and contraction. It's not pain, you're just feeling that muscle work. Once we do 5 to 10 reps on this side, we'll slowly transition across to the other side. And we're going to do the exact same thing. Grounded palm, spiraled elbow, packed shoulder, tall spine. Inhale into that back hip. Feel that weight, drop the hip down. Exhale, lifts the hip, reaches that hip, slides it forward, actively scooping so that we start to feel that stretch on the front. Try to feel that contraction in the rear. As you get a few reps into this one, notice if this hip feels tighter and more restricted. Is it able to travel as far? On the inhale, does it get down to the floor as low as the other hip? On the exhale, are you able to get as much extension in the front of the hip? Can you feel as much contraction in the rear? Or does it feel a little bit more tighter in the front and harder to get that glute contraction in the back? That can be a symptom, symptom or a signal of some imbalance in the hips. And if you are feeling that imbalance, I want to try to move into it lightly, gently, non-forcefully. See if we can continue to scoop actively and start to feel more of that glute contraction. Can you feel that little bit of burn in the muscle from it working hard? Once we get 5 to 10 reps, we're going to slow transition back to the other side. We're going to do that same exact breath into that back hip. Exhale in the scoop, but now we're going to add in our reach with rotation. So inhale that back hip bowl. Exhale, actively scoop. Lock it in. I want to scoop and feel that good, solid contraction. And then maintaining that contraction, we're adding in our reach. As I reach, I'm spreading my hands, extending the elbows, spiraling my palm up to the ceiling, and then rotating my shoulders, trying to get those fingers to slide forward. Inhale, I'm unwinding, feeling that breath move into that back hip bowl. My chest is more square to front. Exhale, scoop, lock it in, get that glute, feel the contraction of the glute, spread hands, extend elbow as we spiral palm up, and then let that shoulder rotate. With each one, I want to see how, once I lock in that back hip in that scoop, I'm kind of digging into that back knee, reaches into the floor. I'm seeing how far can I get that back knee and my fingers to move away from each other. How much distance can I get in that reach through the fingers from the position of that back knee? Once we get 5 to 10 reps, nice slow transition to the other side. Again, grounded palm, spiraled elbow, packed shoulder, tall spine. Inhale into that back hip bowl. Exhale, lifts, actively scoops, lock in that glute, spreading fingers, extending elbows, spiraling palm up, and rotating shoulder, reaching forward. Inhale, unwinds it. Feel that weight all the way into that back hip bowl. Exhale, scoop. Again, lock in, get that glute. Feel that glute contraction. Then we can move into that spiral reach. Notice if this side feels tighter and more restricted. If the hip was tighter just with our breath into that back hip or with the knee openers, more than likely you're going to feel that same, going to feel tighter as we apply rotation into the low back, up into the shoulder. And these imbalances, one side to the other, are important. I want to pay attention to them. And when I feel them, I want to work and see if I can get them to be a little bit, can I get a little bit more mobility into the areas where it feels tighter and more restricted on one side. Once we get 5 to 10 reps, coming back to the other side, now we're going to get into our our folds. So shin is square with the shoulders, hands are square with the shoulders. Nice inhale into that back hip bowl. Exhale, we'll feel that hip lift, scoop. I want to lock in that back glute as much as we can. It's going to be a little different because we're going to have this opposite hand, back hand off the floor. Hands are going to be square with shoulders as we exhale and reach forward. Inhale brings us all the way back up into that back hip bowl. Exhale, scoop, feel that glute get fired up. Keep that hip active as we fold forward. By keeping that back hip active, we should feel some stretch in the front of that hip. And then as we get into our fold, we'll hopefully also feel some stretch in the opposite glute. So I want to see if we can feel stretch in both areas at the same time. Feel that inhale breath, exhale, actively scoop, and then nice forward fold. Once we get 5 to 10 reps, we'll switch to the other side. Again, shoulders are square with that shin. Inhale into that back hip bowl. Exhale, scoop. Feel that glute fire up. Hands square with the shoulders as we start to fold. Now, my opposite side, I was actually feeling this tighter in the right hip. It's tight into my left hip, which is usually my tighter side. But as I'm getting into this fold, I get a good stretch. So I got some tension here. And as I fold, I feel that more in my right glute. So I am tighter, both front of my left hip, back of my right hip together create greater tension than what I was getting on the other side. And that's an important thing to notice, which is why I want to connect this back hip actively into my fold. These are two things that are kind of paired together in our gait mechanics, so it's a good thing to assess them together as well. Once we get 5 to 10 reps on that side, we're now going to start to go side to side with our folds, moving all the way across. Now, I'm less concerned about maintaining my shin, being square to my shin. We can be a little bit more exploratory here, but I do want to keep that back hip, at least for the first few, scooped actively as I fold. Nice reach. Inhales, we bring it up. We're going to go all the way through to the other side. Actively scoop that back hip as we fold. And by going back and forth, we can really get that good sense of comparison. How does the left side feel compared to the right side? I feel that right hip a little tighter than it has been lately, more so than it is when I'm on this side. Usually it's my left hip that is tighter. This week, I am doing middle school girls basketball. So I've been on the court 5 hours a day. Really, I guess since last Saturday, and today is Thursday. And with my right knee having 5 knee surgeries, I've had a lot of more swelling in my right knee, which creates more issues in the hip. So this tightness in the hip is probably related to a considerable amount of time on the basketball court. Now, as we've been going back and forth, I want to start to open up this back leg, which is going to make it a little bit more challenging to get that scoop, but I want to still lightly scoop into that back hip, even as we open up, just because it creates a little bit more mobility, tension in that hip as we get into the fold. As we move back to the other side, I want to find that same position, lightly feel that scoop as we get into that fold. Right there, I can feel that right side hip even more. So I'm getting some sense of like exactly where that tension and tightness is in the right hip. I'm also feeling it more in the glute on the right hip. So my right hip is just a little bit more taxed today than it has been for a while, which is why I want to go through my movement practice daily. Ideally, first thing in the morning is going to be the best as far as a movement prep, because the more I move to prepare myself for the day, the better quality of movement I'm going to have in the day, which means that by the end of the day, the better results I will have in my movement, and I will probably have a little less pain and discomfort than if I do not go through this first thing in the morning. We're going to continue to open up that back leg more and more. I like doing high reps on the going side to side with the shin box folds, 10 up to 20 reps side to side. We're slowly starting to open up that back leg as much as we comfortably can, making sure that we are not going into pain. So I'm not as concerned about getting into that true yoga class pigeon pose, but I do want to move towards it without forcing it. Good. And we'll come back to our starting point. So now we're going to work a little bit shin box to knees. Now, if you have knee issues, I want to go very soft and safe on this and make sure that it's not painful. If it is painful, then I want you to skip this movement and instead talk to me in a consultation so we can talk about how we can reacquire this movement. To start out, I'm still in my shin box. We're going to use hands to guide through to make sure that it doesn't grind or hurt the knees. So I'm in my left side shin box. My left hand is going to go behind. My right hand is in the front. And I'm kind of doing a push-pull using my hands to help guide me up to knees. Once I'm up, we're doing this light scoop of the pelvis. I want to feel that light stretch through the front of the hips. And then we're going to bring hands back down, guide back to the floor, and then we can move across to the other side and do the same thing. Getting hands in place, guiding up, scoop at the top, and then use the hands to guide down. Now, if the knees feel vulnerable, but that's not painful, using your hands, but it doesn't quite feel like you have the strength, or it feels like it might be a little sketchy to do it without hands, then I want you to just work on this using hands, just getting into these positions for right now, as long as it's not painful, is okay. This is an important functional movement, and I want to work the movement regardless of whether I can do it hands-free or if I have the use of hands. Now, if we have good, strong hips and the knees feel good and strong as well, and we're not getting any pain, we can start to bring the hands off. We're driving through both knees evenly, and really I'm trying to actively scoop the tailbone to help pull me up. And then on the way down, I'm unscooping and I'm turning that tail back and I'm reaching back to come back down to the floor. Then we're going to go across to the other side and do the same thing. Scoop to help bring us up. Keep that scoop active so you feel that stretch in the front. And then we're tilting that tailbone back and reaching back to the floor, going side to side. You can note I'm kind of using my hands to help guide on the transition back and forth for right now. If your core feels good and loose, you can start to work. Can you bring knees across without using hands on the floor? Can we go through this movement hands free, going side to side? We'll do about 5 up to 10 reps on each side. You don't want to keep it slow. And if you need to be using hands, please make sure that you're using hands. The movement is important. Using hands, not using hands is less important. All right. So now we're going to come into an inverted position. So knees are bent, feet in front. Hands are going to come down at the hips or slightly behind. I want to ground the palms down, spiral the elbow pits out and away so that we feel the shoulder blades sliding down the back. Chest is opening up, sternum is lifting up to the ceiling, and we have a nice tall spine. So from here, we're going to do elbow spirals. I got my chest open. I'm in, turning my elbow pits in. As they turn in, it's going to round my shoulders. They're going to kind of slide up to the ears as my upper back gets rounded. I'm also scooping my tailbone so that I get nice and rounded all the way into the low back. This is on exhale. And then as we inhale, spiraling the elbows out, pressing down into the floor. Try to lift the sternum tall and the head tall. Feel that stretch across the top of the chest. Exhale as we spiral in and scoop. While we're doing this, find a point on the wall out in front of you and keep your eyes fixed on it so that your head stays in the same position. I don't want the head kind of tilting up and down. I want the eyes fixed as we move back and forth. Inhale as we get nice and tall. Exhale as we scoop. And then one last thing I want to pay attention to is as we inhale and we spiral out and get tall, that the sternum and the spine are lifting straight up. I don't want the rib cage to stick out where the rib here is going forward. Instead, I want upward lift. Feel the chest open up. So differences from here, nice and tall, rib cage stays down, versus here where the rib cage juts out and the head pushes back. So I want to try to keep that tall spine as much as possible. On your next exhale, as you inhale and get tall, we're going to stay tall. And at this point, we can cross legs, but we're staying grounded down, spiraled out, nice and tall. Again, rib cage is kind of tight, is packed. And we're going to get into our neck mobility. So starting with checking our blind spots. Nice inhale. As we exhale, slowly looking over our right shoulder. Inhale as we come back to the center. Exhale as we slowly look over our left shoulder. And as we go back and forth, see how far can you send your chin over the edge of your shoulder. Notice how far are you able to go. And what I want to avoid here is reaching more from the forehead where the head tilts as we turn. I want that tall spine so that we're moving more from the chin. And the more we're able to move from the chin, the more deeper in that neck you're should feel that mobility. How is that range of motion to the left compared to the right? Is one side tighter, more restricted? Is there some pain? If there is, I want to stay below that level of pain. I do not want to push into the pain. I want to stay in that level 1 to 2, but definitely not going into a level 3. And level 1, level 2 is slight discomfort. It's just a little bit more than a stretch. It's not registering and triggering into that pain where we feel the body tightening up to protect. We'll come back to our starting point, nice tall spine, and now we're going to get into light tilt and lift. So I don't want to tilt, I don't want to drop my ear all the way to my shoulder. It's just a light tilt. And then opposite ear, we're lifting it up like a piece of string is pulling our ear, or like we're trying to touch that ear to the ceiling. At the same time, same shoulder, feel that weight pressing down into that palm as that ear lifts up. Inhale as we come to center. Exhale as we go to the other side, tilt and lift. Again, as we lift that ear, feel the weight of that hand and shoulder pressing down into the floor to create traction. And I'm gonna give you a couple more things that we can kind of work on this. So we can play with the position of our chin as we're doing these tilts and lifts. So I want to keep the shoulder blades packed down and back so it's a tall spine, but we can extend the chin out and do tilts and lifts. And we're gonna feel that in the neck a little bit differently based on having that chin in a different position. Then we can bring that chin more into a neutral position, doing the same thing. Again, elbows are still outwardly spiraled, packed shoulders, but the chin is more neutral, not so extended out. Notice how that feels. Does it feel a little different? Can you feel it stretch or tension in different areas of the neck? And then the last one is, I'm really going to draw that chin in tight as I tilt and lift. And it's almost like as I lift, I'm reaching my chin backwards, like I'm trying to move my chin to the, like kind of to my occipital bone in the back of the skull. So I'm kind of pulling in and lifting backwards, side to side. You know, all those little changes in that joint position of the head will give you a little bit different mobility in the neck. So last for neck, we're going to do just some shallow neck rolls. Let the chin drop down to the chest. Ears going to roll towards the shoulder. Eyes will look up to the ceiling. Opposite ear to the opposite shoulder. And then chin back down to chest. And then we're going to slowly start to smooth that out into a circle, making sure it is not painful. And as we get into it, we can start to deepen that circle, get a little deeper, let the head drop a little bit more, as long as we're not taking it into pain. I don't want to have that tension where my neck or my shoulders start to protect. So keep it shallow enough that the shoulders stay downwardly pressed without wanting to kind of shrug up to protect the neck because it's uncomfortable or painful. Once we do 5 circles in one direction, we're going to come back to our starting point and we're going to start shallow again. So chin to chest, left ear to knee or to shoulder, eyes up to the ceiling, right ear to the right shoulder, and then chin back down to chest. And then we can start to smooth that circle out and get a little bit deeper into it. Good. All right, so now we're going to get into quadruped, getting into hands and knees. And I want to have the toes tucked. And we're going to start with just some simple rock backs. So I want to do some rock backs because I want to kind of check into the knees so that we can start working in a deep kneel position. But since I have some swelling in this knee, before I do a lot of work that requires that knee, I need to assess it to make sure that it is not painful. So inhale, we're kind of rocking forwards into the wrists. On the exhale, I want to feel the weight of the hips sink to the hips. We're loading into the big toe joint, but we're also seeing how close can I get hips to heels and how does that feel in the knee space. Inhale brings us back forward. Exhale, feel that weight of hips to heels. If you're not able to get the hips all the way to the heels, is it because is one knee kind of preventing it? Does one side want to go deeper and the other side feels like you can't get quite as deep? That might be an indication of some inflammation or swelling in the knee. We can now untuck our toes and do the same thing with the ankles flat to the floor. Sinking hips to heels. On this one, again, I'm still focusing on the knees, but I'm also paying attention to the ankles. Does one ankle feel tighter? Am I able to get my ankles relatively flat to the floor? Does one ankle have a little bit of a gap in space? Is there a stretch there? If I feel a stretch, can I move into that stretch lightly and get it to mobilize? And then the next part is, if we're able to get hips all the way to the heels, can we start to sit? Can we shift our weight to apply the weight to the heels and then coming all the way back forward? Now, I am able to get all the way back into a sit. I have a little bit more tension into the medial compartment of my right knee because there's a little bit of inflammation and swelling. Doesn't feel, it's not painful, but I feel that tension. So I'm gonna go a little bit light with what we're doing next. So we're gonna come now into a tall kneel position. And we can do this with both toes tucked and toes untucked. I'm going to start with toes tucked. So I want to feel that big toe kind of tucked and loaded to give me some bracing support. So if I start to fall back, I can push through the toes. From this tall position, we're going to get into our pelvic tilts with breath. So inhale into that belly, allow the pelvis to tilt forward so that we get this sway in the back and the belly opens up. As we exhale, drawing that navel up and into the spine as we actively scoop. See if you feel some light stretch through the front of the thighs. Inhale as we breathe, let that tilt forward. Exhale, scoop. Notice if there's some pinch or discomfort in one direction of your tilt, especially at the low back. So as you exhale, scoop, I want to start to feel tension in the core. As we inhale, tilt forward, making sure that we're not like getting some tension in that low back. I have a little bit of pinch in my low back today, so I want to be a little softer. I'm not going to force it, but I do want to see if a little bit of moving back and forth helps to get it to open up. My body really likes the scoop. Now, if we're able to do this without pain, we can now start to work into a little bit of a lean back. But real important on the lean back, as I actively scoop, notice how my rib cage is drawing down, my pelvis is scooping, and I got a real strong core brace. And my back is like a plank. From here, as long as I can maintain that scoop and that rib cage down, I can start to lean back lightly and then come right back up. But if I am not able to maintain that scoop, what will happen is that pelvis will open up, I'll get a sway in my back, and I'm going to lean back at the shoulders like I'm rolling backwards. I don't want that. I want to maintain active core. Rib cage should be drawing down. If anything, shoulders should be more forward, a little bit forward as we lean back in order to help maintain that braced core. As we get to the top, we can take an inhale, let the belly open up, exhale to actively scoop again, and then lean back into it, keeping that core braced. This is going to put a lot of stretch and strain into the front of the hips and down into the quads. Again, this is a nice core bracing activator, especially getting into that lower core because I have to maintain that pelvic position. Once we get about 5 to 10 reps, we'll untuck the toes. We're going to do the same thing. Now with the toes untucked, it's going to be different, so I want to make sure we start lightly. Inhale, pelvis tilts forward, belly opens up. Exhale, scoop, drawing navel into spine. Again, maintaining that good plank, rib cage down. Don't lean as far into this one. Make sure you have good quad support. Inhale, pelvis goes forward. Exhale, active scoop. Feel that core engage as we then lean back. And again, once we get 5 to 10 reps, we're now going to come all the way down onto our back. From here, I want to do a little bit, partly because I was feeling that low back tension. I want to do a little bit of rotation through the lower legs. So I'm keeping my feet on the floor, and I want to bring ankles and knees together, and I want to keep them together. Arms are going to come out to the sides with the palms up. This is basically going to be our supine hip rotation that we do, except I'm bringing feet to the floor. So from here, we're going to rotate the hips. And as I rotate the hips, I want to keep my knees and my ankles together as I go side to side. So ankles and knees are together. As I rotate, one foot should come completely off the ground. As I rotate over the other foot, the hip should be rotating up towards the ceiling, but I want to keep the shoulder blades soft and relaxed on the floor. Inhale as we bring it up. Exhale as we then let it roll to the other side. And I just want to kind of feel that nice little stretch down into the low back, into the hips a little bit. Noticing how does that feel as we go left side and into right side. Again, nice slow movement with the breath, just to get a little mobilization into that low back area. Good. Now we're going to let both legs go straight. We're going to bend one knee, foot comes flat to the floor. We're going to move that foot out to 45 degrees from our midline, and we're going to get some single leg glute activation. So we're just firing the one leg. I got my right leg down, my left leg is straight. The opposite leg should be completely relaxed. The opposite hip is going to be relaxed. We're going to drive through this hip. It's going to, or this foot, scooping up, and it's going to lift this hip up, and we're going to roll over the other hip. I want this foot to be nice and flat, grounded, spread. I want equal pressure through the heel, ball of the big toe, all the way out to the ball of the pinky toe, and I want the toes themselves to be spread out and grounded as well. I want nice, flat grounding to the floor. We're going to press down through that foot, and we're going to start with just some little pelvic tilts on that side. So downward pressure in the foot. We're going to inhale, let that belly open up as the pelvis tilts, the top of the pelvis tilts up towards the ceiling. As we exhale, navel comes into the spine, and we're scooping. Feel that tailbone move up to the ceiling. Inhale, draws the belly up. Exhale, scoops the tailbone up. And with each one, as you exhale, see if you can feel that tailbone lift up towards the ceiling by planting through that foot. This is just one side that is active. Inhale, bring it all the way back to the floor. Belly opens up. We get this big sway in the back. Exhale, belly presses down into the spine as we scoop, and start to feel that scoop get us higher and higher, so that we start to feel a stretch on the front of this hip, and we start to feel a contraction in the back. Again, the opposite leg is relaxed. As I press my right foot, I don't want my left hip lifting off the ground. If the left hip is coming off the ground, it means I am pushing through my left foot, and that foot should be not doing anything. Left hip is on the ground. Right hip lifts up and rolls over that left hip. Now, next exhale, as we get to the top, we're going to keep it at the top. Continue to feel that nice spread, grounded, pressed foot. We're actively pushing down. We're now going to inhale, exhale, and tilt, but keeping that hip elevated. So inhale, feel the belly open up, pelvis tilts towards the ceiling. Exhale, draw the navel in as we actively scoop. Feel more of that load stretch through the front of the hip. Feel that contraction more in the glute. I want to feel that glute start to burn a little bit because it's working. We're trying to get some good neurological activation into that glute through the foot. The foot needs to be downwardly pressing. The hips need to be actively scooping in order to get that full contraction of that glute. After we do a good 5 to 10 reps of those, we're going to come back to letting that inhale, the hip drop all the way to the floor. Exhale, brings it all the way back up for another 5 reps. Again, I want to feel that glute starting to feel a little bit fatigued. Let's see if we can get it some work. I'm feeling that tightness in the front of this hip that I was feeling earlier, but it's starting to open up more, and I'm getting some better glute contraction in the rear. Once we finish with those 5 reps, we're going to switch legs. So legs start straight, bending that opposite foot, bringing it flat to the floor, moving it out to about 45 degrees from the midline of the body. Foot is downwardly pressed, grounded, spread and grounded. Inhale, we're starting just with pelvic tilts. Inhale lifts the belly, pelvis tilts up to the ceiling. Exhale, drawing the navel down, pressing the spine into the floor, and actively scooping that tailbone like you're trying to move it up to the ceiling. With each one, as we inhale, feeling that extension of the spine moving up. On our exhale, as we draw that navel in, scoop up a little bit higher. Start to feel that tailbone elevate up so that we start to feel some stretch in the front of the hip. And the more we actively move into that stretch at the front, we are going to start to feel that tightening contraction in the rear. Pay attention to that opposite leg. Make sure that opposite hip is completely soft and relaxed on the ground. That opposite foot is not pushing. It is not working at all. All effort is just on one side. Really start to work into that extension. Start to feel that maximum contraction in the glute. Again, keeping the foot spread, evenly grounded throughout the foot. On your next exhale at the top, we're going to keep it at the top, and we're going to just work that light tilt. Inhale, belly opens up. Exhale, actively scoop into it a little bit more. And with each exhale, see if you can get more and more of that firing in the glute. I want to start to feel that maximum level of contraction. Start to feel it burn a little bit from the work. After we get 5 or 10 of those isolated scoops, we're going to come back for 5 more. Full range all the way down. Exhale as we actively scoop all the way up. Again, I want to feel that glute starting to burn. I want to feel it evenly on this side as I felt on the other side. This as an activation drill is a good one to do every single day, especially if you deal with any kind of glute inhibition, which most adults do. Once we're done with that, bring both feet flat to the floor. We're going to come back to our crocodile breath, making a nice big C shapes with our hands, thumbs in the back, index fingers in the front, wrapping around that abdominal musculature, cinching down a little bit to create some resistance for the inhale. And we're going to get a good 5 to 10. Nice, slow inhale. Fill up that balloon nice and wide. On the exhale, we're deflating that balloon fully as we draw that navel up and in towards the spine. Let those hands cinch down a little bit. And see if you can start to inflate that balloon a little bit more with each inhale. And notice How much of that inflation can you get compared to the beginning of the class? Is it more symmetrical? Do you feel that even expansion into the thumbs and into the palms on both the right and the left side? And to finish off, we can allow the arms to soften down, palms up, let the shoulders relax. Bring that breath, continue to breathe into that crocodile breath in the abdominals, but also start to let that breath move up more into the ribs, chest, side body ribs, and upper back. Same general principles, feel it expanding out like a balloon on the inhale. Exhale, navel still draws up and into the spine. Allow your shoulders and your neck to soften and relax with each exhale. The inhale, we're kind of breathing into tension. On the exhale, we're letting that tension melt into the floor. We're just letting it go. You can take your time with this breath if you need a little bit more time. Don't be in a rush to get up if you're feeling tension in your chest and your shoulders and your neck or in your low back. Spend a little bit of extra time breathing into it and see if you can use that inhale breath to stretch and expand, and let that exhale breath let it go and soften and relax. See if you can get that area to move a little bit more by spending a few minutes just with a nice soft breath. And when you're ready, you can open your eyes. Since we're spending a good amount of time on the floor with breath, make sure you take your time before you sit and you stand to make sure that you're not dizzy or lightheaded.